This video talks about bipolar disorder, what you can do to prevent or overcome the bipolar disorder, and other available resources. Some of the keywords include bipolar disorder, mental health, treatment, rehab, health, mental disorders, mania, manic depressive disorders, manic depression, depression, psychological disorders, healthiest mind and body, alcohol, etc. If you are new to Healthiest Mind channel, welcome to our channel and please subscribe for more interesting videos like this. It doesn't really matter if you have already been diagnosed with bipolar disorder type 1 or 2 or if you have already been battling it out for some time now. What's important is that you have full control of the situation that you're experiencing. There can be no other person who can work it all out unless you decided it on your own to get better. You're the only one who can help yourself. Well, there are also available resources like support from family and friends, mental institutions and facilities, and the like. But apart from those support systems that are readily available to give some helping hand, you can do it on your own. How? Here are some ideas. 1. Be in the know. You have to read more and more about what you are experiencing in order to better understand the illness that you're in. Knowledge is one important factor to keep for you to learn about the facts of the disorder. You can also impart the knowledge to your family so that when certain abnormal activities may occur, they know what to do. It is also advisable to contact your physician for preferences. 2. Establish normality. Do not let your disorder be in the way of doing tasks that you normally do. It is important that you let yourself overcome the disease and not be overcome by it. Your daily routines like doing the chores, working, walking your dog, and sleeping at least 6 to 8 hours a day can greatly help in order to forget that you are bipolar. Exercise is also one factor that can take negative energy, like stress, inside the body. 3. Take prescribed medications. Because bipolar is a recurrent disorder, you cannot stop it unless your doctor says so. You have to take your medications that are only prescribed by your doctor. Antidepressive drugs and mood stabilizers should be taken daily even though you are already feeling better or no signs of manic or depressive episodes are experienced. Now, if there are signs of side effects, and you can no longer tolerate it, inform your physician immediately to let him suggest other alternatives or reduce the dosage of the drug. 4. Do away with stressor and stimulants. It is important that you avoid factors that can stimulate the occurrence of your disorder. People and situations that will cause you to become positively or negatively hyper must be avoided. This may cause agitation or aggravate the behavior you're into. Stimulants can be regarded as nicotine, cigarette smoking, caffeine, coffee, sodas, chocolates, and other possible stimulants that can cause the stimulation of your condition. These can also cause sleeplessness. 5. Stop alcohol consumption. This is one of the wisest things that you can do to protect yourself from behavioral occurrences. Alcohol is a natural depressant and increased consumption can trigger your case. Furthermore, alcohol neutralizes the medicinal effects of your treatments and can alter its effects, which can result in damaging your liver and other possible health problems. Things may go out of hand. Therefore, whatever happens, make your therapist and your doctor your best of friends. If you can no longer handle the crisis, it is, therefore, necessary to ask for help from people who know how bipolar disorder occurs. These people can make it more better for you and your health. Thank you for watching, and if you liked the video, give it thumbs up and please subscribe to Healthiest Mind channel for new videos every week. We'd love you to catch up on our latest uploads below and connect with us on social media. Facebook, Healthiest Mind for Real.